It's the pelvic floor issue people are most likely to feel ashamed about, and maybe not even want to discuss with their physical therapist. So buckle up, folks, because on today's episode of Taking the Floor, we are so going there and busting the stigma around pooping problems so that you can get the help that you need.
I think it's just easy to be embarrassed and not talk about it and not be open about it. I mean, especially your bowel movements is not a topic at the dinner table.
Welcome to Taking the Floor, the podcast from Hinge Health about pelvic health, movement, and taking charge of your well-being.
We're your hosts. I'm Kandis Daroski.
And I'm Bijal Toprani.
And we're both pelvic health physical therapists here at Hinge Health. Thank you for being here today. Today, we're talking about all things poop, including how your pelvic floor plays a role in your bowel movements. And unless you're a pretty open person, or maybe even a pelvic health physical therapist like Bijal or I, your bowel habits are not typically your go-to conversation starter at a dinner party. So when people are having problems in the bathroom, they're either just dealing with it, confiding in a trusted friend or two, or even just turning to Google or Instagram for answers. And a lot of people are more comfortable Googling it than bringing it up with their healthcare provider. So unless the provider specifically is asking them questions around it, it's generally not going to come up.
But here's the thing. Your bowel habits can be a pretty important indicator of health in a lot of different ways. And when you're having problems like constipation or the other end of the spectrum, trouble holding in your feces, it can be a sign of issues with your pelvic floor. But that's actually good news in a way, because that means it may be treatable, as in fewer bathroom problems, but you can't get treatment unless you're willing to talk about it.
And trust me, I feel like I can speak for all of us when I say your pelvic floor physical therapist is so not embarrassed to talk about it. I can't tell you how many times pooping or pooping problems come up in my professional conversations. Honestly, I'm practically talking about it all the time.
Yeah, I gotta admit, you kind of are always talking about it, Kandis. But all of us are. As PTs, we're not afraid to go there because we know that these kinds of problems can be really life-altering. You start changing how you exercise and socialize. You worry about how you're going to manage at work and start to structure your life around the bathroom.
So why don't we just jump right in? And you're probably thinking, okay, I get it, we poop. But what do we actually mean when we say pooping problems? Let's go through a few of them to get started. So first, it's that uncomfortable constipation that really leaves you feeling bloated, sluggish, and struggling with difficult bowel movements.
There's also bowel urgency, which is an intense and undeniable urge to poop, regardless of the time or the place or how close you are to a bathroom.
And then with that, there's also the inability to control bowel movements. So that's resulting in accidents or what we would call fecal incontinence.
Finally, difficulty completing bowel movements, leading to the need to have frequent bowel movements.
I often give a little speech where, titled "Pooping is the Great Equalizer." And what I mean by that is that everybody poops. And sometimes it can feel really hard for people to understand what it's like to live with a pelvic floor problem. And so I don't think there's really any of us that haven't experienced a bout of constipation or that, oh my gosh, I'm not going to make it to the bathroom moment in our lives. And that feels terrible, right? And that's how I'll describe it to people who don't understand pelvic floor dysfunction is what if you were living with that sensation every single day? How would you feel? And what if you knew that there were things that you could try? Even some sort of simple things, right? Like certain exercises or strategies you could use in the bathroom that could improve that. And while it's hard for people to talk about these issues, there are people that kind of step up and are brave enough and willing to share a little bit about their experiences. And I just want to commend that bravery because when we help others realize that they are not the only people dealing with these problems, we make them feel less alone. So let's hear from one of our members, Nicole, about how her bowel symptoms were a major challenge for her after the birth of her twins.
for some reason, that's just how it impacted my recovery is just going to the bathroom. Yeah, I had a lot of issues there. It's kind of like embarrassing, like me having to run to the bathroom right away. It was just very hard to hold. I just had to run to the bathroom. Like I could be nursing and all of a sudden it's like, I really have to go to the bathroom and I have to put down my babies and they're both crying and I'm like having to run to the bathroom.
What really stands out to me about Nicole's situation is that, you know, we all poop, right? We've made that clear. It's a part of life, but life is always happening. So you're always having to feed your kids or go to work. But when you start having a pooping problem like Nicole is having, life can start to feel really small. Like it's just managing life and managing these problems that you're having. And we really want to move away from just managing and move towards actually living, where this isn't something that's like taking over all aspects of life.
You're so right. It's that idea of like really living life uninhibited by symptoms that hold you back. So let's break it all down and really talk about what can lead to problems with bowel movements, how they can impact your life, and most importantly, how you can do something about it.
Yeah, let's dive into that. Let's talk numbers real quick. As many as 1 in 4 people deal with constipation, so 25% of the population, and it's more common in women. 1 in 12 adults deal with fecal incontinence. It's even higher for women and for older people.
Yeah, and around 3% of the population deals with fecal urgency, which is that sudden, undeniable urge to need to use the restroom. And just want to call out that this is higher for women and older adults, and also those who are also dealing with GI disorders. And up to 50% of women have some degree of pelvic organ prolapse, which can lead to difficulty completely emptying the bowels. That's a lot of people. And there is, of course, the physical discomfort that a lot of these problems can bring on, but there's also tons of emotional impacts that may not seem so obvious up front. So these are things like isolation, feeling really tied to your home because you're not sure if you go out, if you're going to be able to manage these problems. It's that like kind of feeling gross or, feeling that a lot of people will describe, especially individuals who are experiencing fecal leakage or incontinence. And the discomfort and the bloating that constipation brings and just feeling obsessed with the bathroom in general. And then I don't know about you, Rachel, but if you've ever been constipated, like you're generally not feeling really great about the way that you look either. So it has several different implications on one's life.
Yeah, and I always notice like the cognitive load of these things, right? You're just kind of worrying about, what kind of help do I need? Do I need a specialist? Do I need to go to a GI doctor? Should I not eat this? If I do eat this, is it going to make my symptoms worse? So it kind of ends up leading to a lot of questions and then having to kind of search for these answers. So what is behind these bowel problems? Bowel issues and their causes can be a chicken or the egg kind of thing. It can be hard to know what led to what because a lot of causes and symptoms are interrelated. Let's look at some factors that play into constipation first. One is dehydration. So when you're not getting enough water, your intestines don't have adequate hydration to add to your stool. So that ends up with you having harder to pass or lumpier stool. So when your organs are not actually hydrated, that can cause an increase in constipation. The next is diet. So if you're not getting enough fiber, you can be constipated. But there's also heredity. Some people just have sluggish digestive systems, courtesy of their genes.
Yes, just another thing to thank good old mom and dad for. And along that same note, pregnancy and childbirth can be things that lead to digestive issues. And so everyone who has given birth knows about postpartum bowel sluggishness and that fear of that first monumental bowel movement when it finally does happen. Really, regardless of type of birth you had, it can be really scary. And it typically occurs due to a combination of factors, including hormonal changes, physical trauma from childbirth, dehydration, reduced physical activity, and then just an overall change in your diet during that time. But whatever the cause is, it's common for constipation to stick around for a while after delivery, which then can become chronic for some.
Yeah, and if constipation becomes a regular thing and there's discomfort or pain along with it, you might find yourself dreading or anticipating the discomfort. So now you have stress and anxiety, which leads to more pelvic muscle tension and more constipation. It can become a vicious cycle.
Yeah, and everyone has experienced this at some point, even if it's just for a day or a short period of time, and it's miserable. Dealing with these symptoms on the regular, though, it really sounds like, oh, not a big deal, but it really can take over someone's life because now everything that they do is centered around pooping. If they have, if they haven't, when they're going to, and what the day is going to be like if they don't.
Yeah, absolutely. I feel like, everyone can kind of relate to this sensation again, whether it's been for a moment or it's been ongoing. I know like vacations can be a big time that this can happen to people, change of scenery, travel schedules, you're changing the meals that you're having. And that point is really just to say that there's a lot of different contributing factors to constipation.
Yeah, I think they term it travel gut. is the term I've heard for that. But another unpleasant truth is that if you're dealing with urinary incontinence or leakage, constipation can actually make that worse. It's just a pressure situation. If you're prone to leaking and your gut is really full of poop, there's just going to be less room for urine and more pressure on your bladder, which makes your urinary leakage harder to manage.
Now, here's something that a lot of people don't know or think about. There's actually a big connection between the pelvic floor and pooping, and it can have a lot to do with constipation issues. If your pelvic floor muscles are tight, it can make it harder to relax to allow stool to pass through. So, what can make your pelvic floor muscles too tight? Holding stress and tension in your pelvic floor muscles is a pretty common culprit.
And everybody holds stress in different places, right? But if you carry it in your pelvic floor, the tension can make it really hard to have that bowel movement and can lead to some other pretty disruptive pelvic symptoms like pelvic pain, urinary urgency, and frequency. And because the stool has to pass through an opening in the pelvic floor, and if the muscles are too tight, it can just make it really hard for that stool to pass through. And sometimes if it does pass through, you're left with some sort of like weird types of poop, right? Like skinny poops is something that a lot of people refer to. And that's because the pelvic floor is just not fully relaxing to let that full bowel movement come out. And, we have a really great mini episode about stress and the connection it has to the pelvic floor if this is something that you think you would like to learn a little bit more about.
Yeah, that's so true and so important to think about the impact that a tight pelvic floor has on your constipation symptoms. And let's not forget the opposite side of the coin, which is when your pelvic floor muscles are weak. Pelvic floor muscle weakness is often at the root of poop problems that are the opposite of constipation. Here I'm talking about things like bowel urgency and fecal incontinence. Weak pelvic floor muscles can make it harder to hold back your stool when you feel the urge and lead to staining in your underwear or accidents.
And we hear it from so many people. And this is even something that I think people have an even harder time talking about because it can feel so embarrassing or stigmatizing. And we want to just hop in and get to the tips for how to manage all of this, but we wanted to take a step back and really look at what causes weak pelvic floor muscles to start with, because there are a lot of factors to consider here. And we cover a lot of these in other episodes, but we're just going to kind of keep it pretty high level and talk about some of the contributors to pelvic floor muscles that have become weakened. And actually, the first one I wanted to mention was this sort of chicken and egg situation, which is a history of chronic straining with constipation can actually weaken the pelvic floor muscles and then now cause this other problem, right? Which is like maybe having some leakage associated with your bowel movements. And that strain on your muscles and tissues during pregnancy or childbirth, whether that's, through a vaginal birth or a C-section, can also be a pretty big culprit.
Age can also be part of it. Without effort and intention, our muscles can get weaker as we get older. Also, hormone changes in menopause can play a role in muscle changes.
And lastly, there's pelvic organ prolapse, which can also be a part of the equation. And this is when the muscles and tissues of the pelvic floor weaken and allow your pelvic organs to drop down from their usual position. And this one can really create either of the problems we've discussed, fecal incontinence or constipation, because it can make it harder to hold in stool, but it can also lead to constipation and difficulty fully emptying your bowel if prolapsed organs are blocking the path of that stool.
All right, time for a medical disclaimer alert. Of course, there are many other things that can contribute to bowel problems, and some conditions need medical attention. If you have persistent diarrhea or constipation, blood in your stool, pain with bowel movements, or other changes in color, consistency, size, or frequency of your bowel movements, you should see your doctor to rule out other problems.
Okay, that was a lot, but we are officially in a no panic zone here. So let's look at the $1 million question. What can you do to tame your bowels and get back to feeling better? The best news is that there is a serious laundry list of things that you can do to help. For constipation and difficult bowel movements, the tips fall into 3 general buckets. First, there's eating and drinking. So you want to aim to have 8 to 12 glasses of water a day, which is just going to keep your stools, soft, easy to pass and keep your body overall hydrated. But you also want to kind of boost your dietary fiber, which is going to really bulk up that stool and make it kind of the appropriate consistency, which makes it easy to pass, but also keeps it from being too loose.
Second, we have bathroom behaviors. Don't delay when you feel the urge. Also, practice good pooping technique. That means that you want to sit upright. You want to use a toilet stool if you have one that allows your knees to get higher than your hip joint. You want to try to not strain and instead relax with your urge. So you want to practice deep breathing while you're having that bowel movement. And there are a bunch of other really specific techniques you can try depending on your unique combination of issues, and your PT can help you figure out what to try.
And if you're experiencing that maybe the urge isn't coming on its own, there are also some things that you can try. And one really easy thing to try is to schedule it. Our bodies really love and respond well to routine. So kind of planning your toilet time for the same time every single day, maybe right after you have a meal, is a great time to try and really put that into practice. And then one of my personal favorites to recommend is a bowel massage to really encourage your bowels to move and stimulate the urge to go. And this is very simple. It just involves rubbing your stomach, at certain points to just kind of help stimulate the poop to move through. So if you'd like to learn more, there's actually a really great article about this linked in the show notes. And if you have any questions about that specific technique, you could also reach out to your physical therapist.
And the last bucket of tips for constipation, exercise. Don't act surprised, you guys, we're PTs. It helps to stimulate the muscles in your intestines that move your stool along. So you want to aim for at least 20 to 30 minutes of daily movement. Walking is a great choice, but really any aerobic activity like biking, jogging, or swimming will do the trick. Even low-intensity activities like stretching and yoga can help. And your Hinge Health exercises can help your bowel and pelvic floor health at the same time. We love a major win-win, or as I like to say, feeding 2 birds with 1 scone.
And for sort of the opposite end of this spectrum, or bowel urgency and fecal incontinence, there are also a lot of ways to manage in the moment, including identifying bathroom locations in advance when you're out. Maybe you opt to wear a pad if you're worried about having an accident. carrying a change of clothes with you, using types of deodorants and exploring incontinence devices with your healthcare provider. But even better, there are ways to address and improve your symptoms. And some of those include, again, feel like a kind of a on repeat here, stay hydrated, which is often maybe counterintuitive for people, but we do want to make sure that we're keeping the stool an appropriate consistency. And we can do that also with boosting that fiber. The more fiber in your diet really makes that stool firmer, which makes it easier for you to hold in. And for some people, keeping a food and bathroom log for just a week or two to track their symptoms and identify any culprits in their diet can really be helpful in finding what is contributing to their symptoms.
And Kegels and other pelvic floor exercises to strengthen your pelvic floor muscles are really important. They can help make it easier to hold it in until you have access to a bathroom. You could also consider using a pelvic floor trainer, which is a vaginal biofeedback device that can help you improve your Kegel technique and strengthen your pelvic floor muscles. If you're curious about adding a pelvic trainer to your Hinge Health program, message your PT to talk about it.
And as we mentioned earlier, bowel training or kind of scheduling those bowel movements out can also work here as well. So for urgency and fecal incontinence, it often involves going to the bathroom at a specific time each day, let's say after we have breakfast, to help you establish more control through routine. And of course, it also helps here to just use those good toilet techniques like Bijal mentioned earlier.
Okay, let's circle back to Nicole, our member who dealt with postpartum fecal incontinence. Nicole worked closely with her PT and coach and incorporated a bunch of different approaches to improve her symptoms.
She kind of walked me through how the pelvic floor works and why I had impact down there. And then also the articles that are posted after each of the workouts kind of walk through that as well. So that was really helpful, because it's a topic that is kind of embarrassing. So it's not something I want to talk about. So just to be able to read in detail the articles and just kind of reaffirm like, hey, this is normal. This happens to a lot of people. And just because it's normal doesn't make it acceptable. So that was comforting as well. So I actually have a playlist that has a lot of different Kegel exercises, but they're in different positions. So it's not just like the classic, just sit there and hold for a certain amount. Also just learning that it's not just Kegel exercises, other exercises that need to be done in order to strengthen the pelvic floor. So just kind of trusting the process and noticing the impacts to my day-to-day life, like nursing.
Hopefully what we have been able to accomplish today is to share some tips with our listeners and let them know in the words of Nicole that, just because it's normal, it doesn't make it acceptable. And we 100% feel that way and are always here to help.
Okay, ready for the 3 most important things to remember from this episode? First, pooping problems are common, have a lot of different causes, and can have an outsized impact on your life.
Next, bowel issues can include a lot of different things, such as constipation, bowel urgency, fecal incontinence, and difficulty completing bowel movements.
And lastly, some of these issues can be tied to weakness or tightness of the pelvic floor, which is treatable with pelvic floor physical therapy. In addition, there are a lot of pretty straightforward diet and lifestyle changes that can improve your symptoms.
Okay, friends, did you get the message? You can improve your pelvic health and address your pooping problems all at the same time. That sounds like a non-negotiable to me. Speaking of which, let's just do a really quick check-in on how we're taking care of ourselves this week. What is your non-negotiable this week, Bijal?
My non-negotiable of the week is that I have started journaling in the morning for 5 minutes. So I am setting a timer and I open up my notebook and I just write whatever comes to mind, and I don't put any pressure on myself. I don't have to be like an author or anything like that. It's whatever comes into my brain. And it's been really helpful because journaling stops me from scrolling on my phone. So it actually makes me pop out of bed after 5 minutes instead of like staying in the bed for like 30 minutes or 45 minutes, which isn't really conducive to my exercise routine or my work life. So yeah, I've been journaling in the morning, which has been super helpful. What's your non-negotiable for the week?
I love yours, Bijal. Isn't it wild? Like 5 minutes on Instagram is like, it goes by so fast, and 5 minutes journaling feels different. And well, something I've been kind of thinking about working on this week and have already tried to put into action is actually warming up before my workouts. I'm really great about staying consistent with like my exercise routine, but I just the way I always describe it is I'm always just like tornadoing from like one activity to the next. And I always have just like these, like, I got to get to the, gym so I can like get my workout in. And a lot of times that means that I skip out on this like really valuable part of the workout process, which is warming your body up. And I know that that's maybe like a little bit cringy to hear from a PT, but I skip it. So if you do too, I totally get it. But so yeah, just spending like maybe 2 or 3 minutes walking on the treadmill before I hop into my exercise routine, just to get the blood pumping and also to feel a little bit more intentional about what I'm doing.
I love it. Warming up the brain and the bod. And with that, thank you so much for listening, everyone. If you could use some more help with your bathroom habits, be sure to check out the links in our show notes or check in with your care team. We also recommend trying the guided breathing session in your app library about how to make pooping more comfortable. Remember, if you're dealing with pelvic floor issues, you are not alone, and we are here for you.
The information contained in this podcast is intended to be used for educational purposes only and does not constitute medical advice or treatment for any specific condition. Please consult with your healthcare provider with any questions you may have about your medical condition or treatment. Check out your Hinge Health app library for new episodes coming soon.